So, you in the last module, what we have seen? In the last module we have seen how to perform ECG experiment, right. It is a long module. So, I hope yeah, you guys were able to stick to your chair and look at it, because it is not so easy to show online how to perform ECG, actually how to take the signals from the ECG electrodes and do the signal conditioning circuit in real time, right. So, we have tried our best to show it to you how it can be done by using different signal conditioning circuits. Now, when you talk about ECG, you also know that there is the lot of different variation of heart disease are there. One of them is atrial fibrillation. Now, when you talk about fibrillation and atrial fibrillation, it is beating of irregular beats, heartbeats, and actually that happens because of the misfiring of signals. So, you see when the heart beats suddenly faster, right, that is one of the arrhythmia, but when it beats abnormally, is fast, slows down, again fast, right. So, it is not a rhythmic way of beating, then it is called arrhythmia. And if you see the heart, right, this is how how we have learned this particular the physiology, where we have inferior vena cava, we have ventricles, left ventricle, right ventricle, right atrium, left atrium, pulmonary trunk, aorta, supravena cava, right. But as you can see here, this is how the actual heart looks like, right. So, the heart that you draw and then heart that you see, is very different. Okay. So, this is a real heart, and then you can see the Purkinje fibers, right, and this is like a extremely important organ, right, and the moment it starts beating abnormally, there are a lot of lot of thing happens. One of the problem is the clotting of blood, right. So, what exactly this atrial fibrillation is and how it can be cured. Now, why we are talking about atrial fibrillation and how can be cured? Because we have just seen about the ECG measurement. So, that ECG signal can help us to understand that the person is suffering from atrial fibrillation, right. And that is why I am showing you this particular slides to help you out that what exactly is a atrial fibrillation, and how it is cured, and what kind of electronic system we can design integrating the op-amp component, and also how to design a sensor that can help to make the surgery better. Alright. So, that is our idea. So, if you see this slide, I will play the atrial fibrillation so that you can understand what exactly we are talking about.
Atrial fibrillation, or Afib, is a heart condition that causes the heart to race and beat in an irregular rhythm. People often say that when they have an episode of Afib, they feel as though a fish is flopping around in their chest, or that their heart feels like it will explode. Afib can increase your risk of heart failure, stroke, and even death. Because of these risks, and because Afib can get worse over time, it is important to have it diagnosed early and cared for appropriately. Afib is the most common type of irregular heartbeat, or arrhythmia. It affects over 2.5 million people in the United States alone. Your heart is a muscle that acts like a pump. With each beat, it squeezes or contracts to push blood to the rest of your body. Your heart has 4 chambers. The 2 upper chambers are called atria. The 2 lower chambers are called ventricles. Under normal conditions, the upper and lower chambers of the heart work together to pump blood throughout the body. The bloodstream enters the atrium, where blood is pumped to the ventricles in a regular and coordinated way. From there, blood is pumped from the ventricles to various parts of the body. A healthy heart beats in a regular, steady rhythm or pattern. Notice how the heart beats evenly and uniformly. In a healthy heart, electrical signals travel through the heart in a regular pattern, as seen here. These electrical impulses originate in a special section of the atrium and travel through the heart in a regular pattern. Each signal ultimately causes the heart to beat. In Afib, the top 2 chambers of the heart, or atria, beat very fast and in an irregular pattern that is out of rhythm. Notice how the atria appear to quiver and are uncoordinated. Due to this irregular pattern, the atria do not coordinate with the ventricles, and the heart is out of rhythm. Afib occurs when electrical signals start in the wrong place and misfire. The faulty signals cause the atria to quiver and not contract completely. Notice how the signals spread in a rapid, disorganized way. Your doctor may perform a test called an electrocardiogram or an EKG to see your heart's electrical activity and rhythm. During an EKG, small electrodes are placed on specific parts of your arms, chest, and legs using small stickers. When the heart beats, the electrodes send signals to the EKG machine. The EKG measures the electrical impulses or waves shown here as lines. See the differences between a healthy heart and a heart in Afib? In a normal heart, beats are evenly spaced and show a regular pattern. In Afib, the waves appear more chaotic and random. While the causes of Afib are often unknown, there are a number of things that increase the chances you might get it. Some of these include age, family history, smoking, high blood pressure, or hypertension and obesity. Also, if you have any of the following conditions, you're more at risk of Afib: heart failure, diabetes, or coronary artery disease. The more of these risk factors you have, the more likely it is you might experience Afib. Be sure to discuss your full medical history with your healthcare provider. Afib often gets worse as time goes on. It's important to take care of it early because the longer your heartbeat is out of rhythm, the harder it is to return to normal. In this chart, the red lines represent Afib episodes, and the blue lines represent times when the heart is in rhythm. When many patients are first diagnosed, they experience periods of Afib that may come and go. These episodes may be momentary or last for days, but generally go away on their own. This is called paroxysmal Afib. In some situations, Afib may not go away on its own. Your doctor may need to perform a procedure or provide medicine for a cardioversion to bring your heart back to normal rhythm. This is called persistent Afib. In some people who have had Afib for a long time, the heart may not be able to return to a normal rhythm at all. This is called permanent Afib. Notice that over time, the red areas are larger and more frequent. This is why it's important to talk to your healthcare provider to be sure that you're doing all you can to keep your heart in rhythm. There are many signs and symptoms of Afib. Many describe an uneven, flopping, or racing heartbeat. Afib can make you feel lightheaded, dizzy, or even short of breath. Some people feel tired or weak. Others experience chest pain or discomfort, such as palpitations. These symptoms might be subtle or severe, and they may come and go, and you may not experience any symptoms at all. In fact, 60% of patients don't even know when they're having an Afib episode. If you have Afib, it's important to know that while you may not feel symptoms all of the time, your heart may still be out of rhythm, and you're still at risk for other complications like remodeling or stroke. If left untreated, Afib can change the size and even the shape of your heart through a process called remodeling. Remodeling can cause permanent changes in your heart in a very short amount of time, potentially just a few days. Because of Afib, your heart has to work much harder, and heart tissue can be damaged. Notice how the heart increases in size and its walls thicken. Even if you're currently being treated for Afib, it's important to understand if your management program is addressing all the risks associated with the disease. During Afib, blood can collect or pool in your heart and cause a clot to form. If this happens, the clot can travel from the heart to the brain and cause a stroke. If you have Afib, you're 5 times more likely to have a stroke than someone who doesn't have it. It's important to talk to your healthcare provider about your risk of stroke and how to reduce it. You may feel exhausted and weak as a result of your heart not pumping properly. While some people with Afib may be able to lead a normal lifestyle, In some cases, having AFib can keep you from enjoying exercise and everyday activities. If you have AFib, you're 4 times more likely to end up in the hospital 3 or more times than those who don't have the disease. It's important that you continue to talk to your doctor about managing your AFib, even if you are not currently experiencing symptoms. The AFib treatment guidelines for healthcare providers recommend a comprehensive approach to treating all the risks of AFib. The guidelines prioritize 3 treatment goals: rate control, maintenance of normal rhythm, and stroke prevention. Healthcare providers may provide a range of treatments to jointly manage the different risks and symptoms of AFib. There are a number of ways that AFib is treated. Your doctor may prescribe a medication to slow down the pace or rate at which your heart beats. Notice that the rate medication slows down the heart rate. However, the heart continues to beat irregularly and out of rhythm. Rate control medications do not correct the irregular heart rhythm associated with AFib. They slow the heart rate down, but don't address the irregular rhythm or pattern of AFib. Your doctor may recommend a treatment designed to more specifically address the rhythm of your heart. When rhythm control medication is used, the heart beats in normal rhythm, but remains fast. Rhythm treatment regulates your heart rhythm, but may have little or no effect on the rate at which your heart beats. Combination of rate and rhythm control treatments may be recommended to reduce the heart rate and maintain the normal heart rhythm. Rate control medication is used to slow the heart rate down. When rhythm control is added, the goal is to have the heart beat at a normal rhythm. Other treatments for AFib may include surgical and non-surgical procedures and implanted devices. If medicine has not been effective, your doctor may perform a procedure called a cardioversion, in which electrical current is used to restore a normal heart rhythm. Radiofrequency ablation, sometimes called catheter ablation, is a procedure that stops the heart from setting off the faulty electrical signals that cause the chaotic heartbeats of AFib. Surgical ablation is a surgical procedure to destroy the cells causing abnormal heart rhythm. It may be used when other treatments have not worked. The surgeon treats the surface of the heart directly rather than relying on catheters and x-rays to reach the heart. For some patients, a small battery-powered device called an atrial pacemaker may be implanted under the skin to generate electrical signals to regulate heartbeat. Talk with your healthcare provider about which treatment options are best for you. Whichever plan you decide on, it's important to remember that AFib is a progressive disease. The longer you wait to restore your normal heartbeat, the more difficult it is for your heart to return to a normal rhythm. Finally, keep in mind that a comprehensive approach to treating all the risks of AFib is important. Brought to you by Sanofi.
Now, when you are talking about atrial fibrillation, also let us see that atrial fibrillation is what we have seen in the video, right. But to cure it, what surgeon has to do, he has to insert the catheter and then he has to burn this tissue. So, this is a heart tissue, assume that this is a heart tissue. And we have to burn the tissue because the misfiring of the signal happens in this particular region. So, you have to burn this tissue. Burning of this tissue is called ablation. Burning of tissue is called ablation. Now, because we are using a tool called catheter, right, which is a very thin tube, and we are hitting or burning the tissue, it is called catheter ablation. Now, within catheter ablation also there is a cryo ablation and then there is a RF frequency that is used to heat or burn the tissue. Cryo is cold. So, let us see how the catheter ablation is performed through this video and then we move to the next slide.
Depending on activity level, the heart beats about 60 to 100 times per minute. It may be higher during exercise or lower at rest. A normal heart rate and rhythm ensures the delivery of oxygen-rich blood to all of the body's organs, such as the brain and lungs. A group of cells in the heart, called the cardiac conduction system, uses electrical impulses to control the speed and rhythm of each heartbeat. An abnormal heart rate or rhythm, called an arrhythmia, occurs when there's a problem with the heart's conduction system. Tachycardia is a type of arrhythmia where the heart beats too fast. Fibrillation is a type of arrhythmia where the heart beats irregularly and may be too fast. For certain types of arrhythmias, a catheter ablation procedure may be necessary to stop the heart tissue from causing the arrhythmia. After numbing a small area in the groin with a needle, the doctor will insert a short hollow tube called a catheter sheath into the femoral vein. Next, a long flexible tube called a catheter will be inserted through the sheath. The doctor will guide the catheter to the heart through a blood vessel that goes to the heart, called the inferior vena cava. The location and progress of the catheter will be monitored. When the catheter reaches the heart, the doctor will guide it to the area that is causing the arrhythmia. The doctor will find the problem areas using a 3D map of the electrical activity of the patient's heart. The tip of the catheter will emit either hot energy or cold energy to ablate the tissue in this area. Ablation makes the treated area stop working. For an atrial arrhythmia, a doctor will ablate the atrial tissue causing it. If the affected tissues are small, well-defined areas, the procedure is called focal ablation. Or if the affected tissues are larger areas with more complex rhythm disturbances, the doctor may perform a procedure called ablation remodeling. Both types of ablation restore normal electrical impulses and prevent an arrhythmia from happening. If the cause of the arrhythmia is in the ventricle, the doctor can do either focal ablation or ablation remodeling to treat more complex arrhythmias of the ventricle.
Okay. So, the video you have seen shows about the catheter ablation. Now, let us see how can we design a sensor that can help us to understand the catheter contact force. You understood, right, that in the video that the catheter is inserted, it is placed onto the heart, right, to get the electrical signals. Once the electrical signals where is a misfiring is identified, you have to burn this with the help of RF ablation, right, or catheter ablation. Now, when you are touching the heart tissue, you should know how much force you are applying. Let's say this is a catheter and I am touching the heart tissue. How much force I am applying to this heart? It is very important, because more force will burn the other areas of the heart. If less force will cause reoccurrence. So, I had to use an optimized force, right. So, I had to design a sensor that can help me to get the real time contact force from the catheter. Now, when I say help me, it is not actually helping me, it is to help the surgeon. So, when a surgeon is operating the patient, and if he or she has to ablate the heart tissue, if the information on the force is provided through the catheter contact, then it makes surgery better. That is one of the aspect. Second aspect is if you can have a haptic feedback to the catheter, because whenever you press, right, if you can take a pen and you can just press on your screen, just do not press too much, it will break. On the board you can try to do that, and when you press it, what you feel? You feel a force, right, you feel a force, how much force you are applying. That is a haptic feedback. You have a feedback. Now, the catheter right now does not have this kind of feedback. It can only show you the contact force. What about we add the haptic feedback to the catheter? Is it useful? That means that we can not only see the contact force, but we can also feel the force that you are applying. Right. So, that is the idea, that is the motivation for me to teach you this particular module, right, and we will talk little bit quickly about how we can fabricate a sensor that can be integrated onto this catheter, and that can be used to for in a actual surgery, and what kind of electronic module you can design so as to understand this contact force measurement, right. So, that is the idea. So, if you see the slide, what you see here is a house fly. This is a house fly, and house fly is sitting on the sensor. This is the sensor that we have designed. Now, of course, this is a dead fly and this is a FESEM image. FESEM stands for field emission, field emission, field emission, scanning electron microscopy, scanning electron microscopy or microscope. All right. So, field emission scanning electron microscopy used to take this particular image. The image is of a house fly, right, house fly, right, sitting on the sensor, sitting on the sensor. Now, the idea was to understand what is the weight of the housefly and can we measure the that weight with the help of the sensor. So, that is the photograph for you, but let us not deviate ourselves too much from the actual problem. Actual problem is whenever I am applying force on the heart, I want to see what is the change, what is the amount of force that I am applying. That is the first task. To understand that, let us see how can we fabricate sensor. To fabricate sensor, let us understand first very quickly few things, right. The first thing is photolithography, but before that let me explain you what are the masks, mask, and I will explain you photoresists, mask and photoresist. Now, when you talk about mask, there are two types of masks: bright field mask, bright field, and dark field. I will show you the bright field mask and dark field mask in the next lecture. All right. And when you talk about photoresist, there are two types: positive photoresist and negative photoresist, right. This is photoresists, photoresists, all right. Bright field mask, dark field mask, positive photoresist, negative photoresist, got it. Now, if I have bright field mask, that means let us say I am drawing a circle or this particular pattern, right, and in this case I am drawing a dark field mask for you, so to you understand. I will also show it to you, like I said, how the mask looks like. Just to quickly explain you how the dark field mask schematic looks like. Okay, I will just draw quickly this one. I am sorry, it takes little bit more time, but it is very important for me to explain you this particular process, so that you can design a sensor and then integrate that sensor for the application that we are talking about. You can also use this sensor for other applications. Okay, once you know the lithography process, you can use it for a lot of other applications. Okay, so this is one mask. Let me help you with drawing another one, which is here. Okay. What you see here and here is that here the field is bright. You see this field is transparent, right, and the pattern is dark. Field is transparent, pattern is dark. In this case, field is dark, pattern is transparent. You understood? That is why this is a bright field mask and this one is a dark field mask. You got it? Bright field and dark field. Now, let us understand one more thing is if I use a bright field mask, okay, and I am using a positive photoresist. So, I am using this bright field mask and I am using a positive photoresist. Then my silicon wafer will have a similar pattern, that is, assume that, let me quickly draw like this. That means that the same pattern can be transferred to the silicon substrate, right, if I use the bright field mask and positive photoresist, if I am using the bright field mask and positive photoresist, right. But if I go for negative photoresist, my silicon wafer will have this area transparent, I am sorry, this area transparent and other area, let me just draw like lines so that we save our time. You assume that this line is completely filled like this one. Okay. So, when we have a negative photoresist, then we have a pattern which is opposite to the mask. This is my mask, right. I am using bright field mask with positive photoresist, I am using this mask with negative photoresist. When I am using positive photoresist, similar pattern is transferred to the oxidized silicon wafer or a substrate, and when I am using a negative photoresist, the opposite pattern is transferred to the substrate. This much is easy. Now, let us use a dark field mask and use silicon substrate. So, let me just remove this one, right. Now, with dark field mask, if I go for positive photoresist and if I use negative photoresist, what will happen? For positive photoresist, I will have my substrate looks like this, and for negative photoresist, I will have my substrate which looks like this one. Now, you see what is happening. The positive photoresist, the area which is not exposed, in UV ultraviolet light will get stronger. In the case of positive photoresist, the area which is not exposed will get stronger, and that is why you are getting this wafer because the area in this particular dark field mask is not exposed, the red one is not exposed, the transparent one is exposed. So, that will become weaker. That is why what you find here is that all the area is stronger except the area which is in the center because it is exposed, right. In case of negative photoresist, the area which is not exposed will get weaker. The area which is not exposed will get weaker, and that is why what you see is this particular substrate. You see here the area which is not exposed is out and the area which is exposed, this transparent one, is intact. You got it? So, dark field mask, bright field mask, right, bright field mask, dark field mask, positive photoresist, negative photoresist. Positive photoresist, area that is not exposed will get stronger, positive. In negative photoresist, area which is not exposed will get weaker. Easy, right, extremely easy, right. So, let us see now how the mask looks like and how the wafer looks like before we go to the actual fabrication. So, let me show it to you this how the mask looks like and how the wafer looks like in the next module, followed by which we will see how can we quickly perform a lithography process to fabricate a sensor for the catheter ablation, right, and then we will see how can we design the electronic conditioning system, right. Till then you just focus on the atrial fibrillation part you understand what is the ablation, catheter ablation, then you understand what exactly lithography consists of, in which we have discussed masks and we have discussed the photoresist. Till then you take care. I will see you in the next module where we discuss more about the mask and the wafer and then the sensor design. Bye.